So I want to talk about expressing hidden variants in your body. So variants are part of your genome that are not naturally or not in the best genetic design, and we get passed on to us from our ancestors. And after a while, we can have certain predispositions based upon what stressors we have, what stressor they had in their life, and so that can play into how we deal with all kinds of things from detoxification. So the way that we can monitor these things, we can actually do a genome test and actually see what you have the potential for, but then we have to use something called an organic acid test, which kind of tells us the output of a, how do I say that? So we can test your genome and actually see what you have a potential for there. But what is actually being expressed, we have to use an organic acid test for. And that's how we can determine whether or not we're making a change or what's going on in your body as we sit there and try to attempt certain things with certain nutrition or certain other modalities that we're using to change how your genome works. So some of the other things that we do is some of the kinesiology testing.
There, can't sit there. Go ahead.
So we can also use kinesiology testing to come through and test a lot of these things and actually test in real world where you're actually at the moment you're in the treatment room. So by rebalancing these pathways, we can actually go through and establish normalcy in your detoxification, in your neurotransmitters, and many other pathways in your body, so you can actually go back to healing the correct way versus taking a lot of binders and things like that that'll actually kind of cause more issues in the long term. So for true healing and true normalcy in the body, we need to reestablish normal pathways. So there's certain types of infections that can be problematic when you have Lyme disease. And parasites are a big one, because parasites can actually hold this type of Borrelia burgdorferi in them by being infected with it themselves. And as we clear it out of the body and you're feeling good, you start to feel like you're living your life again, and then you hear so many people have a relapse. All of a sudden they get infected again or something comes back. And that's in large part due to the fact that these parasites are just re-releasing into your body, and your immune system dipped just low enough where they can reinfect you again. This is a big issue and needs to be dealt with. I've had lots of patients that come back and have done ovoparasite testing, they've done all these different types of tests, and it comes back negative, and yet through the type of kinesiology testing that we have, we can go through and find parasites that have been hidden, and people send us pictures of all kinds of things. It's amazing. We have an entire collection. So there's a triad of issues when we deal with Lyme and parasites, and the other part of that is heavy metals. Because heavy metals are toxic to the body, and parasites will actually start to absorb some of those heavy metals and actually kind of help us out, and the body will kind of allow them to linger around for a while. And so if we're really going to try to get rid of that, we also have to address heavy metal chelation. How's your body detoxify from heavy metals? Even going back to methylation in the body, do we clean it out properly? So we need to detoxify the body and get these out of there and keep you from being reinfected or actually being re-toxified from all these things in the environment, whether it's in your food, your water, the air you breathe. Where are you getting these things from, and how are they creating this environment for parasites to continue to grow and thus allowing Lyme to continue in your body?